Hi, this is the informative speech assignment given to an audience of 3 to 5 adult college students attending a liberal arts Christian university. My purpose is to inform people that the job field of a mid-level provider promotes God values by reaching out to those in need and offer comfort as Jesus did. Through the healing of the mental, the physical, and spiritual portions of a person, health and function can be restored. So I'm going to inform the audience today how the career field of a mid-level provider, i.e. a nurse practitioner, physician assistant, nurse anesthetist, and such, through their healing of the mental, physical, and spiritual portions of a person, health and function can be restored, which is something God greatly values. Mid-level providers have shaped and will continue to shape the future of healthcare. Over the years, the role of the mid-level provider has expanded in reaction to the advances in scientific knowledge and the changes in the healthcare needs. While it remains unclear at this time how healthcare reform efforts overall will transform healthcare delivery, it is abundantly clear that mid-level providers will be a fundamental component of the future of American healthcare services. Being a mid-level provider is a very progressive, fulfilling career opportunity with job security for those wanting to serve others through the ministry of healing. I've gained an invaluable understanding of the mid-level provider career field through my work as a paramedic and EMT for the past 19 years. I'm also married to a mid-level provider, a nurse practitioner, and this gives me direct access to the world of a nurse practitioner and/or mid-level provider and what they go through. If you are looking to fulfill a higher calling and pursue a career opportunity as a mid-level provider, you can significantly impact people's lives directly through the healing work of your hands and the ministry of the Lord. You can honor God and humanity through the healing work of your hands. So during the next few minutes, we'll be discussing the mid-level career field and show you that Americans need more mid-level providers out there in America. MLPs and APPs have significantly improved access to healthcare for Americans. Since the implementation of the Affordable Care Act under President Obama several years ago, the number of APPs and MLPs has significantly risen, and this is a good thing. Due to the pressure from the federal government and healthcare systems nationwide to reduce the cost of healthcare, and the decrease in available physicians nationwide to treat patients, APPs and MLPs have proven beneficial to decreasing healthcare costs associated with and also improving healthcare access. The Bureau of Labor Statistics estimates that the number of physician assistants itself will grow 30.4% from the years of 2014 to 2024. I'm not very good at math, but I know that those statistics are significant. According to analysis of multiple studies conducted by the American Academy of Physician Assistants, hospital-based PAs have helped reduce the cost of hospital readmission rates, which the Affordable Care Act was a big part of that, the length of stays, infection rates, and many studies are broadening the scope of practice for MLPs and APPs. So this has definitely reduced the cost of health care to every taxpayer and every American. 21 states have granted MLPs and APPs full practice privileges, meaning they do not need a collaborating physician to directly impact a patient's care. This decision has been met with a significant enthusiasm by healthcare reformers and health systems nationwide, because it alleviates the high demand for medical providers in rural communities, which is where the need is. Matthew, the 10th chapter, verse 8 says, "Heal the sick, raise the dead, cleanse those with sick skin diseases, drive out demons. You have received free of charge, give free of charge." Jesus commanded his disciples to go out and heal the sick. Of course, the capabilities of an MLP and APP is not as far-reaching as raising the dead, but their impact is still undeniable. Many APPs and MLPs have enjoyed being able to influence the quality of life of Americans nationwide. It is a very fulfilling work, and seeing the efforts of your hard work and your education and your commitment to your career field help people is definitely significant. Next, we're going to talk about Florence Nightingale. Even though she was strictly related to nursing, she has impacted all aspects of healthcare career fields to a great deal, specifically nursing. Florence Nightingale was an English reformer, a statistician, and she was the founder of modern nursing. She came to status while serving as a manager and trainer of wounded soldiers during the Crimean War. She gave nursing a very favorable name and reputation. She became an icon. She was given the name the Lady of the Lamp by making rounds to wounded soldiers at night. She's also credited with improving infection rates, reducing death, mortality, and also a lot of our hygiene now that we see in hospitals and the working class home is due to Florence Nightingale. Florence Nightingale was also credited with setting up the first official nursing school in 1860 through the King's College London. Stephen Paget, in the Dictionary of National Biography, asserted that Nightingale reduced the death rate from 42% down to 2% by making improvements in hygiene alone. Again, I'm not good in math, but those statistics are undeniable. So in summary, we have discussed what APPs and MLPs are. We've went over key points showing that they are doing God's work and ministry through the healing and improvement in quality of life of patients abroad. As patient populations increase, as chronic disease worsens, APPs and MLPs definitely will be needed throughout America abroad. So if you're looking for a career field with job security, career field that can be utilized during mission trips in service of God through your Christian service, if you're looking to heal the sick and injured, if you're looking for a career field that will allow for advancement and continued growth, continuous learning, a decent lifestyle, then becoming an APP or an MLP could be the answer to your prayers and so many other prayers alike. Thank you.